My name is Dr. Greg Waslen. I'm the director of the Plastic Surgery Center in Calgary, Alberta. Today I'd like to discuss the concept of beautification. Beautification was described by Dr. Arthur Swift from Montreal, Canada, and is a technique to help patients become the best that they can be by actual physical measurements. This caliper is designed to measure that exact mathematical relationship, 1 to 1.618. Every patient and everything that's man-made has that mathematical relationship to make it look perfect. We have a model here. Her name is Dee. She's 55 years old, and she's interested in facial rejuvenation. She wants to look as young as she feels. So what are our concepts? Well, we have both surgical and non-surgical concepts. The use of fillers, Botox, and makeup. Ultrasonic machines are the most common non-surgical techniques for facial rejuvenation, and the surgical techniques, of course, include surgery, lifting procedures, as well as inflation procedures and laser resurfacing. We can mark the cheek out as in this area, exactly right here. So this is where the cheek belongs in every person. And if we mark out the maximum point of the cheek, it should be approximately right here. And we can find that out by, again, measuring it with our calipers, which will measure the exact maximum point of every cheek, where every cheek is the most beautiful. And that is going to be at 1.618 from the medial canthus. And you can see, so that is the highlight of the cheek area. Now, if we measure the width of the cheek for this patient, we can see that the cheek is slightly deflated right there. So we know that D could have a little bit of inflation right there to correct a slight hollowness and a slight deflation of her cheek to make her as good as she can be. And so this is a concept that is not just random. We know that because of these markings that no one should ever have filler anterior to this line. We know that the peak should be there and that this is the normal cheek area. And so whether you're using fillers or surgery, these concepts hold true for all patient treatments. So lastly, we have a global approach to facial rejuvenation, which includes both non-surgery and surgery. The surgical concepts include correction of descent of skin, deflation, and skin deterioration. And the final concept is to use the beautification principles to make every patient as best that they can be for themselves.